All right. Well, allow me to quickly review the agenda for today's Grand Rounds. To begin, I will provide a brief overview of who the National Environmental Health Association is and what we do. I will provide some details about our 2024 Annual Educational Conference. Then I will introduce our speaker, who has an amazing presentation planned for you today. Following the presentation, I will provide time for a few questions from the audience. Following that, I will introduce our panel experts who will share their story of experiences, challenges, best practices, and more in their journey to foster and nurture a culture of diversity, equity, and inclusion. After each has shared their story, I will open the floor for additional questions. And lastly, I will bring our seminar to a closing with some final announcements. So with that, allow me to cover a few housekeeping items before we get started. Please note that the seminar is being recorded and will be uploaded to our Grand Rounds webpage. You can find all the recordings for all of our previous seminars there as well. I will put the web address into the chat for you in just a moment. If you have any questions for our speaker or panelists, please do use the Q&A function that you should see on your screen to submit any questions. In addition, if you have, at the conclusion of our seminar today, you will be prompted to fill out an evaluation survey to provide us feedback and comments on today's seminar. Now, for those of you who may not be familiar with Niha, allow me to provide a brief overview of who we are. As an association, everything we do is to build, sustain, and empower environmental public health professionals so that they are equipped and prepared to protect the health of communities across the country. We support environmental public health by continuously providing the most up-to-date training, tools, and resources to the workforce who specialize in so many different fields considered environmental public health. Niha is focused on increasing knowledge and skills across all of our fields to build upon our workforce capacity, efficiency, and effectiveness. We also offer credentials to certify the expertise of our workforce. In addition to our large online library of trainings, seminars, and available tools and resources, we host an annual educational conference, which includes multiple sessions focused on the many different fields of environmental public health, like policy and regulation, extreme weather, preparedness and response, food safety, private wells, water quality, climate change, wildfire response and recovery, and so many more. No matter where you are, no matter where you are in your educational journey, our professional careers, Niha has something for you. Check out our website to learn more, niha.org. As I mentioned, each year Niha hosts our annual educational conference. This year's will be held in Pittsburgh, Pennsylvania, July 15th through the 18th. It's not too late to register, and I highly encourage you to consider attending. You can learn more about the AEC online by scanning the QR code here on the screen, or go to our website. I will drop the link in the chat for you in just a moment. Now, with no further delay, allow me to introduce our guest speaker. Please welcome Dr. Ayana Perkins, a community psychologist specializing in public health research and evaluation since 2001. She serves as Chief Health Equity Officer in the Office of the Director for Centers of Disease Control and Prevention, National Center for Environmental Health Division of Environmental Health Science and Practice. In this position, she develops guidance and advises environmental health scientists on the integration of diversity, equity, inclusion, and environmental justice in surveillance, emergency preparedness, interventions, research, and evaluation. As a behavioral scientist, she has specialized in health disparities, partnerships, qualitative methods, and community development for over 20 years. Dr. Perkins has a master's and doctorate in community psychology from Georgia State University and a master's degree in counseling psychology from Clark Atlanta University. Dr. Perkins, I pass the floor on to you.
Thanks for that introduction. Hi, everyone. It's great to be here with you today. Before I begin, let me describe myself to those who are not able to see the video image. I'm an African-American woman with long locks. I'm wearing an orange jacket, and I have a silver nose ring and silver earrings. My pronouns are she and her. Very often when we think of diversity principles, we think of aspirational goals. In my presentation, I will briefly highlight how supporting diversity principles helps us improve the quality, the impact, and the satisfaction with our work in environmental health practices. Continue. Here is a disclaimer. Continue, please. The Division of Environmental Health Science and Practice explores different ways to support environmental health equity for all communities. Continue, please. Health equity, environmental justice, and diversity, equity, inclusion, accessibility, and belonging, DEI for short, make up the three focal points of our division's approach, as seen in that blue figure on the left. This is a transformative approach to health that shifts from monitoring disparities to investigating the burdens and the indicators of a thriving community. The outcome of these efforts is to achieve community resilience and health equity. Each of these levels represent a unique facet of our division's mission to achieve optimal environmental health for all communities through those 8 strategies on the right. In the next slides, I'm going to explain more about the 5 diversity principles that we use, which include diversity, equity, inclusion, accessibility, and belonging, that we often refer to as DEI. Continue, please. Diversity. This is the practice of including the many communities, identities, races, ethnicities, backgrounds, abilities, cultures, and beliefs of a society. We need diversity in everything, in what we learn, who teaches us, who we collect data from, how we collect data, who we hire, how we hire. But on a basic level, when we lack diversity in our universities or the workforce, we may not be even aware of the different cultural and contextual factors that influence environmental health outcomes. In other words, to do our work effectively, we need diversity. Continue, please. Equity. This is consistent and systematic, fair, just, and impartial treatment of all individuals. Equity and equality are very different. When everyone is treated with equality, everyone gets the same thing. But when everyone is treated with equity, everyone gets what they need to thrive. Keywords are needs and thriving. Continue, please. Inclusion. This is defined as the recognition, appreciation, and use the talents and skills of employees of all backgrounds. Now, you can be invited to be part of a setting where equity is championed, but still be faced with structural barriers that limit your full participation. And since we all have different identities and different privileges, we can all serve as allies to create a place for everyone, advocate for the voiceless, teach how we got there, and demonstrate value for them. Continue, please. Accessibility. Now, we're talking about the design, the construction, the development, and maintenance of facilities, information, communication technology, programs, and services that all people can fully and independently use them, and that includes people living with disabilities. For environmental health practice in the workplace, in the school, or in the community, we need to explore if everyone can thrive or achieve optimal performance. And if they cannot, we need to adapt. Continue, please. Belonging. This is the feeling of being an accepted member of a group, or connectedness, giving one's interpersonal relationships a sense of psychological safety. Before belonging can be experienced, diversity, equity, accessibility, and inclusion have to first be achieved. Continue, please. I love this graphic. I adopted it from a model used by Dr. Sherman Gilliam. He's a director at FEMA and a disability specialist. But what I wanted to demonstrate that in order to create a sense of belonging, it can only occur after the creation of understanding, beliefs, application, and measurement of diversity, equity, inclusion, and accessibility principles. Only after these have been completed and achieved, then we can look at exploring whether or not we created a sense of belonging. Continue, please. Health equity is a state in which everyone has a fair and just opportunity to attain their highest level of health. Health equity and DEI are distinct and separate concepts, but there are specific touch points between health equity and DEI. At CDC, we integrate these diversity principles as part of CDC's Health Equity Cultivate, Optimize, Reinforce, and Enhance initiative, better known as the CORE initiative. Now, if you look at the box at the bottom two rows, the R and E are where health equity and DEI really meet at the crossroads. R refers to the reinforcing and expanding of robust partnerships, which depends on inviting members of communities that have been marginalized or underserved. And this is where I spend a lot of my time as a community psychologist. Now, the E, which refers to enhancing capacity and workforce engagement, involves in creating space in recruitment and retention strategies using diversity principles. And I do some of this in my collaboration with Niha's internship program and in our belonging initiatives in our division. Continue, please. Continue. Oh, thank you. Vital signs like heart rate, temperature, and weight tells us what's going on in our body. Vital conditions tells us what's going on in our community and in the world around us. We use the vital conditions social determinants of health framework, which is pictured here in the circle on the left, to explore the diversity and need. Vital conditions are properties of places and institutions that we need all the time to reach our full potential, like access to food, humane housing, access to meaningful work and wealth, and a sense of belonging. Continue, please. How we access these vital resources varies. It's important in environmental health practice that we remember that we need to tailor access to vital resources based on the needs of that community. And the needs of different communities are diverse. So I'm just going to jump around this circle a bit for examples. At the blue plus sign on the 3 o'clock position on the right sits the domain name basic needs. Each community differs on what is respectful and culturally relevant care. Now, in our wildfire response in 2023 in Hawaii, we were reminded that some communities, help seeking is a family affair, and in some prefer to meet alone with a provider. Now, moving to the yellow quadrant on the left side, we have lifelong learning. And developing tools like data dashboards, it's important to consider the various learning styles, literacy levels, technological preferences, neurodiversity, access to resources. If we don't create the space for DEAB, we won't be able to support the diversity of need in our communities. Continue, please. Continue. Okay, thank you. Environmental justice means the just treatment and meaningful involvement of all people, regardless of income, race, color, national origin, tribal affiliation, or disability. And this executive order 14096 was released in April 2023, and it highlights the equity principles of DEAB and encourages us all to prioritize populations that have been overexposed to environmental health hazards and create space to collaborate with all communities, especially those who have been minoritized and marginalized, on solutions. Continue, please. Diversity, equity, inclusion, accessibility, and belonging are important elements for the creation of a welcoming culture within the workforce, programs, interventions, and selection of partners. The integration of these elements helps to create psychological safety, spaces for meaningful contribution, equal access to resources, and respect and understanding of diverse perspectives. And a final thought I want to leave you with is DEAB is more of a journey than a destination, and we are all learners. Thank you for your attention.
Thank you so much, Dr. Perkins, for your presentation today. At this time, we will accept some questions from the audience. If you would please use the Q&A to drop your questions in. Dr. Perkins, I actually have a question that I'd like to ask you. How does your division integrate DEAB principles when collaborating with partners and local communities?
That's a very good question. One of the first things we do is we create new spaces for the ways that we engage partners. We realize that for many years that several sectors have not been invited to the table. So one of the ways through our collaboration with Niha, we have been connecting with institutions like colleges and universities that have a long history with supporting our minority populations. And another thing that we've been doing is that we are developing research collaboratives where we invite researchers to collaborate with our scientists and find new ways to address disparities. We're also finding new ways to engage the community when it comes to developing our tools. So we are working with new partners that we haven't worked with to get our tools out to make sure that they're useful. We also are always using evaluation. We integrate evaluation in everything we do to make sure that we're continually learning. Thank you.
Well, thank you very much. We have a few questions for you, Ayana. First from Joetta de Francisco. What advice would you give to organizations just starting out in the DEI process?
Well, we had the great fortune of having a very strong commitment to DEAB and health equity based on a need to address the disparities uncovered under the COVID-19 pandemic. And so because of that, there was a plan to develop capacity. So after the agency-wide commitment, we made sure that we were all speaking the same language and we understood the concepts. And so we did a lot of trainings. So that was a great first step. A second major step is that we integrate DEAB principles throughout our strategic plan. So we would also be able to refer to that document, and we also use the strategic plan when working with our recipients. And so we use those two building blocks to make sure we would have like a strong foundation.
Well, thank you. Next question is from Mary Beverly. Would you have a great scenario you could share regarding an environmental problem where environmental health inspectors have used DEAB as a framework to solve a problem?
I don't, because my background is not in environmental health food inspection, but we do have experts within our division that I can refer that question to and get back with you.
Thank you. Next question is from Jean-Pierre Nishiyama. What DEI implementation challenges have you observed as currently trending across communities in the U.S.?
Well, one of the trends that I am discovering is that the way we're hiring, we want to hire the same way. And so we are continuing to get the same folks showing up. And so what we're doing, because that's something that's just come up for us, is that we have to realize that if we're not getting all the candidates that we need and we're not making sure we diversify our hiring pool, that we may have to change our recruitment strategies. And one of the ways that we're doing that is going to those communities. Some communities, based on the level of need, the folks in the community don't want to leave their community. So we are expanding our remote options and creating positions where folks don't have to leave their community, but still lend support and expertise to CDC. One of the things that was done differently for me when I was hired was that they sent my resume without my name. My first and middle name are of African descent, and they wanted to make sure that unconscious bias didn't play a role in my selection. And so how you actually get people to select the best candidates and make sure you don't trigger unconscious bias is another way. We're also working through subject matter experts. We are working with American Indian, Alaskan Native, subject matter experts and finding ways on how we can engage in developing research opportunities, as well as making sure that our opportunities for employment are open and well distributed among those communities. And so that means we have to travel to those areas. So we've held tribal summits last year where we got to ask questions about what would make it easier to collaborate with us, what would make it easier to work for us, what would make it easier for us to support your needs. And so again, one of the things we have to do is being willing to do things differently and become uncomfortable.
Wow, thank you, Dr. Perkins. Ann Carter has another question. What resources can you recommend to help incorporate plain language, user-friendly, in field outreach documents and develop pictorial information?
I'm on mute, excuse me. That is actually something that CDC as an agency is really working hard to support. We actually have a lot of health equity communication and plain language examples. If you leave me your email address, I can make sure I can share that with you. And it's an ongoing commitment. I'm not saying we have it perfect, but we have started in that direction. Thank you for that question.
Another question from the audience. How can we further protect diversity within environmental health when there is a lack of diversity already?
So this is a really good question. And I have to admit, I really enjoyed my collaboration with Niha's internship program for the last couple of years because this has come up. One of the things that we wanted to do is to find out how do we increase awareness of environmental health opportunities. And so what we did was we held discussions with historically Black colleges and universities, alumni who are working here at CDC to get an understanding how they were exposed to environmental health programs at their colleges and universities. Many of them explained to us they were not made aware about different opportunities in environmental health careers. And so one of the things that we walked away with is that we had to promote awareness at earlier ages. This last year, I've been working with the White House in developing an environmental justice research plan. And one of the things that we know is that there is low awareness. And so what we're doing is developing a summit this summer to engage high school students and to make sure at an earlier age, people are aware of different opportunities. one of my colleagues was saying we should make it very plain. We should let folks know that there are lucrative opportunities and that we showcase the folks who are working in the field, whether in a university level or in the government, so people are exposed. And I have to admit, I wasn't exposed to environmental health careers until I came to CDC. I was aware there were environmental health opportunities, but I didn't know where I could work as a community psychologist. So increasing awareness at earlier ages and making sure at the university level we have diversity in faculty, so people can see that people who look like them have the opportunity to thrive and succeed in those areas. Thank you.
Absolutely. Thank you. Sada Yerbadi, thank you for your comment. We have a question from Caroline Blasovsky. Hello, Dr. Perkins. My experience is in the healthy home arena. We are finding homes to be large risks to public health, from radon, poor water quality, air quality, virus control issues. Do you have any ideas how to reach and integrate DEI with homeowners across the nation?
That's a really good question. One of the things that we have developed as part of our health equity strategic plan was to really emphasize using multi-component home-based interventions. And so we were looking at lead, and you mentioned radon, as well as offering home visiting services for asthma. And so some of the ways that we've worked across our program is engaging our recipients to work with partners who already have expertise in supporting communities who may have been minoritized or marginalized, and making sure that their work or their interventions are culturally relevant and efficient and effective. So one of the things that we have encouraged our recipients is to, of course, work with different partners. We've also have been working with HUD. We make sure that we also demonstrate collaboration at a higher level. And so we're working with HUD to how do we make sure that those homes that don't have the resources to be stable or are able to receive safe structures, that we collaborate with our partners to do kind of like a coordinated approach to care. And so some of our recipients actually, they come in for asthma, but if the inspector or the provider identifies other needs, instead of having a whole new experience, we refer these families to other services they can receive to be less burdensome. So working across partners, but also always asking the question, is our work culturally relevant? Is it contextually relevant? And does it benefit the community? And it varies. Some people don't want people coming into their homes. Some people would rather prefer going to the health department. So always asking the questions, are we doing the right thing? Thanks for that question.
Great. Thank you, Dr. Perkins. To the audience, I see that there are still quite a few questions for Dr. Perkins, but we must continue on with the seminar. I'm going to ask Dr. Perkins if you wouldn't mind answering in the chat or in the Q&A the additional questions that are there. If you wouldn't mind while we
I'm happy to
continue
do
on.
so. Thank you.
Great. Thank you so much. All right. So please allow me to introduce our panel experts on today's topic. Joining us today is Kemi Shamonda. Kemi has been working for the California Department of Public Health for over 5 years. She serves as the Health Equity Liaison at the Center for Environmental Health within the department. Her role is to increase diversity, equity, inclusion, and trauma-informed transformation into the California Department of Public Health workplace cultures, goals, and practices. Prior to her role, Kemi conducted an 8-month assessment looking into diversity, equity, inclusion, and communication practices, and presented findings and recommendations to the department. Prior to the department, Kemi started her public health career in San Francisco, where she obtained her bachelor's and master's in public health from San Francisco State University. Kemi has worked in the areas of women's reproductive health, recreational health, city policy, planning and budgeting, social security benefits, and youth advocacy. During her time at the San Francisco Department of Public Health in the Community Health Equity and Promotion branch, her areas of work included safety routes to schools, Healthy Stores Initiative, HIV prevention, and tobacco-free projects. Next, we have Kieran Strawn. Kieran Strawn is the Environmental Health Services Supervisor of Public Health at the Seattle and King County Public Health Office. She has over 35 years of experience in environmental health. Key's interests are in the areas of servant leadership through quality assurance, workforce and professional development trainings, and program alignment and conformance with voluntary national retail food regulatory program standards. Current food code model with best practices in foodborne illness outbreak and response. She is passionate about interpreting technical code language to simpler educational and cultural competent trainings through diversity, equity, and inclusion lens, and for especially those with English as a second language. Key has co-presented at multiple national and regional conferences and currently serves as the co-chair on the Council to Improve Foodborne Outbreak Response, C4, as some of you may know it, and on the Retail Food Advisory Collaborative Group and Conference of Food Protection Council, two standing committees, as well as served as mentor for the Niha Leadership Academy. She has also been instrumental in securing multiple trainings and funding resources for the Pacific Northwest region, making it equitable and economically feasible for all staff to participate. AFTO grants, NACHO mentorship programs, EPI-Ready trainings, retail program standards, AFTO environmental sampling, HACCP special processes, and Washington Integrated Food Safety Centers of Excellence. Key is an instructor at the Edmonds College teaching foodborne illness prevention and HACCP. Key was born in Seoul, South Korea, grew up in the Pacific Northwest with an Bachelor of Science from the University of Washington School of Public Health and Community Medicine. And next we have Erica Kurtz, who received her Master of Public Health degree from the Tennessee State University in Nashville, Tennessee. After graduation, she completed the Commissioner's Fellow in Public Health Fellowship with the Tennessee Department of Health. She later served as the Assistant Director of Value-Based Purchasing in the Long-Term Services and Support Program with the state's Medicaid Department. Over the past 5 years, Kurtz has worked as an epidemiologist for the Tennessee Department of Health in the Office of Health Disparities and the Healthcare Associated Infections and Antimicrobial Resistance Program. She is now the Senior Epidemiologist for Injury Prevention in the Division of Family Health and Wellness. Kurtz has a passion for health equity and advocating for underserved communities. She is also pursuing her Doctor of Public Health degree in Health Equity and Social Justice at Johns Hopkins Bloomberg School of Public Health. So welcome to the three of you. And I know that you will be sharing your stories today with the audience. Let's begin with Kemi, if you don't mind.
Yeah. Hi, everyone. So I wanted to start with, prior to my position as a health equity liaison, I was working in tobacco control, and I had the opportunity to be part of a leadership development program. And the program, you get to choose a topic that has to do with what you want to change within TDPH. And so I thought about my experience as an employee within the workplace culture, and I thought a lot about diversity, equity, and inclusion and communication within the workplace. So as Nicole mentioned, I did an 8-month-long project looking into the department, and I had recommendations for the department, and one of those recommendations was to create this position, the health equity liaison position. And I thought it was really important to find out that the director of the department was actually aligned with a lot of the key findings that was in my assessment. So within a very few months, the department created an initiative, which is called Being Best at Getting Better, where we're focusing internally on the workplace culture, how we can really improve diversity, equity, and inclusion, but also even going further with becoming a healing organization and kind of creating that space of psychological safety. We know that we do great work within the state of California, but we wanted to be better internally so that we can do even better work with supporting the state of California. So when it comes to, advancing diversity, equity, and inclusion, and really creating initiatives, it is extremely, extremely helpful to have decision makers at the very top who are aligned with your values and what you're trying to advance within the center.
Great. Thank you so much, Kemi, for sharing. And we will go to Erica.
Thank you. So I wanted to kind of tell about a journey of how we got our equity program pushed through. So as you heard from my bio, I spent my first few years as an epidemiologist working in the Office of Minority Health and Disparities Elimination. This office has since been renamed to the Office of Health Disparities. But in this role, the concept of equity and thinking through who our vulnerable populations are were the core of my work and my focus. So when I moved into a new EPI role with our healthcare associated infections team, I came in with that same mindset. So this team, we were responsible for performing surveillance on various infectious diseases that are acquired in a healthcare setting across the state. So I was thinking through what are the disparities, who are our vulnerable populations, what parts of the state are we seeing higher rates, what are the demographics that are driving these rates, and just out of curiosity, I wanted to explore these things. And to my surprise, I found that our surveillance systems were not equipped to even look into answering these questions. So for context, about 13% of our data had completed race and ethnicity. So we were not able to look at things by race and ethnicity. I couldn't look into social determinants or any of those drivers. So fast forward, I worked with my mentor on our team, and we were able to link our data systems to our hospital discharge data, our death certificate data, to be able to get more of that demographic information. And through this process, we identified a racial ethnic disparity in an organism that was of really great concern. And so I presented this data nationally, and we actually won an award from the Council of State and Territorial Epidemiologists for this work. And that's what gave me the idea to come back to my organization with a plan. So at the time, I didn't call it DEI, but that's essentially what it entailed. I wanted us to modify our systems to be better at detecting disparities, and I really was advocating for having a role specifically for this. So as a part of that proposal, I outlined the gaps in our current programming, how I felt we could overcome these gaps, and this is what led to the development of our health equity epidemiologist position. It also led to having a dedicated staff to help us create and implement our plan for equity. So within this plan, we wanted to address diversifying the workforce, making sure that the resources that we were allocating were going to those most in need, and some various other equity principles. So I also knew that there would be some negative connotation with DEI. Unfortunately, it's being politicized, but luckily our leadership really supported this idea, and they wanted to be better at doing the work through an equity lens. So it wasn't too much of a challenge to get the buy-in from our leadership, especially after we were awarded this national recognition. So just to wrap up, I think in order to start this, especially if you're starting from scratch, you have to do a bit of a needs assessment. So if you're thinking about starting any type of DEI or equity work, you really have to understand your organization, what they need to be successful and what really resonates with your leadership. You really have to get that buy-in to make this work happen. And I also think don't get caught up on placing labels on things, especially if you're in an area where DEI could have that politicization, that you don't have to call it DEI to do the work of DEI. So if you think you will get pushback, you can always recommend strategies by saying, hey, this is the best approach for us to offer these resources to those most in need, and also to ensure that the work we're doing is valuable. So thank you. I look forward to answering any questions y'all may have later on.
Great. Thank you very much, Erica, and for the tips. Great. Thank you. And next we will go to Kieran.
Wow, these are wonderful things to follow. I don't know if there's things that haven't been covered, but I want to first thank you for inviting us to the panel discussion. It's so important, and this topic really resonates with me and our area and county. And we have the DEI it's really equity and social justice is what is referred here, and being named after Dr. Martin Luther King Jr. as our county. We have a very vibrant, diverse, and very increasingly racially and ethnically growing population of over 2 million that represents a lot of basically a fusion of traditions of many cultures. And our county is really deeply committed in DEI or equity, ESJ, equity and social justice principles, and we have a very robust strategic plan, policies that are in place that really want to implement fairness and justice and opportunity to thrive in a very healthy environment to for our workplace as well as communities. So I just want to say that. And also in 2020, Seattle King County declared racism as a public health crisis, and so really brought it up to the forefront and awareness. And I believe with those messaging that more people are learning more about it as a guiding principle. We also have a lot of values and mission and vision, which is called the True North values that value the diversity and belonging to our workplace and community, as Dr. Perkins mentioned, as well as the workforce, and really strive to hire people and staff that represent the communities we serve. And I am one example of one of the public health professionals being born in South Korea and having English as a second language. A lot of the barriers and challenges and just being accessible to the needs are very resonating to me as I grew up with my family interpreting and going through some challenges here to basically live and thrive in a healthy environment. I just wanted to incidentally share the program I work in is the food and facilities program. We have oversight in food safety as well as water rec facilities. But among our staffing, about 65 when fully staffed, we have about 16 dialects spoken among us. So we are very wealthy in terms of resources. We can interpret and communicate with operators there. If we can't, we also regularly utilize the language interpreting line, which has been very helpful as well. But we also ensure that equity is a priority in our program and everything we do. And it's about transparency. And so if that level of equity means that we may be visiting our establishments, additional visits and also incorporating our educational visit that we also have as a tool on top of the regular routine inspections, we have those options and tools to do that. And equity really means to the level that we need to reach to communicate and have understanding from our operators or owners. That's the important message. We want to make sure that or ensure that they understand. And then it doesn't always have to be in English. We try to give translated materials and offer tools and options rather than having office hearings or meetings after enforcement and discovering there's a lot of misunderstandings or of regulatory code language. We offer those options up front so that if we're having some problems with progressive enforcement and understanding with our operators to the level that they need to understand is the most important thing, because we want to make sure that those needs are met and accessible, and that they have a fair chance at running a small business and having all the resources accessible. One of the other things that I wanted to talk about is that one question that was brought up is, what are some challenges in applying DEI or ESG principles? And I wanted to bring it down to a real microscopic level of environmental health perspective of how that applies to our practical daily work levels. And I want to say that one of the things that as we aspire and learn together, we're continuously on this journey of learning and improving and doing our best. We also want to ensure and advocate that our owners and operators can also, as we know that food service and food safety is not just one cuisine or menu. We have diversified owners and operators running very culturally menu options, as more and more people are discovering different cultures, that we want to encourage those to be retained in a safe way. So one of the challenges that I challenge our staff is when they're out in the front line doing inspections and learning cultural competency trainings and improving that, is challenge yourself, as you know the code inside out, to offer options in the food code that may be an option to still retain some of the cultural tradition menus and preparations, with the owner who's very frustrated to meet the requirements, but also be able to retain some of those cultural traditions in a safer way. And you will be, surprised to see their delight and their reaction, like, oh my gosh, this is safer and I can do this and still continue some of the cultural traditions. So those I think are some of the practical challenges that we, ask our environmental professionals to think about as we're doing regulatory oversight, but also prioritizing public health food code and things that we have to meet in a very equitable way and equitable lens. And we just do it, I think, and not even call it this. We just do it by nature. That's part of our work culture. That's part of our community outreach services. And so we don't really think about this other thing. We just do it as in ways that we apply it in everything we do. And so I really appreciate, I know we have a limited time, but we'd love to get into more, but appreciate you letting me share a snippet of what that practical application would be out in the field for environmental professionals as we deal with very diversified communities.
Thank you very much, Key. All of you, thank you so much. I'm going to pose a question that I feel you all have touched on, answering this from the audience from Chris Manley. How do you suggest implementing DEI in environmental health programs beyond just, we apply the same rules to everyone? We often struggle with how to best serve our community while trying to stay within regulations and policies.
And that's a really good question. And again, no one's achieved that perfectness, and there's nothing beyond, learning. We're continuously working on things. You'd be surprised, translated materials, where there's webinars in different languages, community outreach meetings, going to the community centers and churches to offer in-person food safety classes because they're not technology savvy, or bringing the person that speaks their language to really set them up for success. We want them to understand it in their language so that they get the concepts. There's a lot of technical code language that is really hard to understand even in English. And so we try to simplify what it means to them. And we use a lot of translated materials, a lot of visuals in our handouts, so that when we produce a handout in English, can it be translated in our, first and second tier languages that are represented in our community with visuals? That we always think in that sense, that if it can be translated and practiced and shared, We want success and setting people up for success. And it's really an educational journey. And it also means an educational and cultural competency learning journey for our investigators. We encourage them not just to think about regulations and regulatory roles, learn about the culture, learn about the language, learn about the food and the traditions and what it means to talk to an owner about important holidays and things that they do. And you'd be surprised the collaborative relationship you retain with the owner and the trust that you build for them to understand that we understand we want you to be successful, but let's do it all in a safe way, and we'll find a way that's going to work for you.
Yes, thank you, Kay. Kemi or Erica, would you like to touch on that?
No, I
Yeah.
think he did a great
Oh.
job. Go ahead, Kimmy.
I think I was going to say the same thing, that Kieran did a very good job. I think cultural humility is really important. I'm having that understanding and knowing, you know, there's always some things that people kind of struggle with, battle with sometimes when they go into a community. And it's really important to, okay, identify those narratives that you're battling with, and elevate the ones that are the most important, that are true. And I think I just wanted to add to that, to Kieran. I think also, you know, equity is a big part of that, is meeting people where they are and understanding their circumstances. So when it comes to equity in the line of work that people are doing within environmental health, it's really good to have a good, clear vision about what is equity, what it means in your work, and then how it can be utilized and advanced when you go out in the community. And then, you know, that takes a bit of time and brainstorming, but I think that's a really good kind of tool to kind of keep in mind in terms of how we can advance equity. How does that look like and feel like when we walk into certain spaces and we do our work, especially when we do different inspections and meeting with different community members, having a clear vision of that and how that looks like and feels like with the community.
Okay, thank you, Kemi. Go ahead, Erica.
Yeah, and I didn't have much to add to that because I don't necessarily work in that environmental health space, but definitely everything that was mentioned about just being culturally aware of those things could make a big impact.
Yes. Great. I saw a question pop up in the chat from Khadija Farouk. What are some equity frameworks that you could refer to or that you do refer to in your work?
Yes, I would love to answer that. So going back to what I mentioned with California Department of Public Health, we have a priority of the best at getting better. We use results-based accountability and lean management. Our three top priorities is becoming a healing organization, becoming a healing, learning, and impactful organization, developing our people, and tackling key public health principles. So one of my roles is specifically working on becoming a healing organization. And we have an acronym for that called HEART, and that stands for Healing, Equity for All, Anti-Racism, Trauma-Informed Transformation. And we have a strategic plan that we use the GARE model for. So we use Lean, RBA, and GARE model. So the GARE model, if folks are familiar with, is Government Alliance on Race and Equity. And it has visualize, normalize, organize, and operationalize. So we take our HEART initiatives and we plug that in. So visualize, so having a vision and strategic plan on how we're going to integrate HEART as a core value to guide our work. And then we go into normalize. So like having a shared analysis and terminology about normalizing the HEART initiative and having a sense of urgency around that. And then organize, so build an infrastructure, partner. The leaders, all leaders throughout the department of 5,000 employees are on board with becoming a healing organization or heart initiative. And then operationalize, so building health equity tools, using results-based accountability, lean management, as well as creating that, ensuring that institutional accountability and sustainability within the department. And these are on our internal SharePoint that we have with the department. It's displayed for everyone in the department to see that we're doing this work. The A3, our strategic plan, they can see that we're doing this work. They can see the action items and where we are as a department in becoming a healing organization, developing our people, and as well as tackling key public health principles.
Thank you, Kemi. Okay, I am going to pose one more question before I get to the closing announcements. This one's from Doug. For a workforce that doesn't have the depth of non-English speakers, how would you suggest we get materials translated, including inspectors asking questions during an inspection?
Yeah, I think the framework has to really be their resources. I think that we have an educator now that is really in tune with visuals and translated materials and access to those resources already established in King County. And we're not the only program that has the needs across the counties, whatever platform or whatever needs, regulatory or outreach, there's always that translation need. And so once you have those established, it's sort of very routine. Like we expect educational handouts to be translated, and we saw really the outcomes of that during COVID. A lot of our materials were translated in easy, visual, understandable. There was a lot of guidance and when that was being developed, and so a lot of community members said that was so helpful. And so same thing with the lens of regulatory oversight. We want to ensure that whether it's visual or translated in their language or verbally by demonstration at the site that we're inspecting, we're not just talking to them, we're demonstrating and showing what right or wrong might look like, and they'll have this aha moment happening. Whatever that those tools are, we try everything and anything to get communication across, and that is successful. And so I would suggest that reach out to your local other counties that may be more resourceful and find out how they're doing it. Reach out to us and certainly email us. We have a lot of resources posted on our website. I know FDA and CDC have wonderful translated links that you don't have to start from scratch and reproduce. And it's really about networking, collaboration, so you can be smart and efficient with the limited resources that everybody has.
Great, thank you so much. All right, with 1 minute to go, let me close it out. So lastly, I would like to thank Dr. Ayana Perkins for her presentation today, and our panelists, Kemi Shamonda, Kieran Strawn, and Erica Kurtz. Thank you so much. And to all of you who joined us today for Grand Rounds, integrating principles of diversity, equity, and inclusion into environmental public health practice, I would like to ask each of you to complete a short evaluation of today's seminar. We would really love to receive your comments, feedback, and recommendations. Each of you will be prompted immediately following the close of the seminar to complete the evaluation, or you can scan the QR code that is currently on your screen and it'll take you right to it. One last note, today's Grand Round seminar is the final one of our current fiscal year, and we are definitely looking forward to holding more this in the new year. Thank you all for being here with us today. We look forward to seeing you all again soon. Bye-bye.